Welcome to our interview with Dr. Scharer. Today, she will be sharing her expertise with us on grant writing. Thank you so much, Dr. Scharer, for coming.
Well, thank you for inviting me. I'm looking forward to having this discussion with you and with the various people who are going to listen to it.
I have several questions that I'd like to ask you about grant writing. So can we get started
Sure.
with the questions? The first one, what's important for nurse leaders to know about the different types of research studies? In other words, could you give us 3 key must-know tips?
Sure, I'd be glad to do that. First of all, I think it's important to understand that every question, every research question, has a particular methodology that's going to answer that question. And if you choose the wrong methodology, then you're not going to get the answer to the question that you're asking. So, for example, for nurses, if they wanted to find out whether a particular type of intervention helped heal wounds quicker than another intervention, they would need to do an experimental type of study, or in reality, we call them experimental studies, but they're really quasi-experimental studies if we look at it from a pure research standpoint. And that's going to tell us whether intervention A is better than intervention B or vice versa. If you were interested in how patients felt about being in isolation, that's a different kind of a question because we don't have the answers to that, and so the best way to get them is to ask the patients some questions about their experiences in isolation, and that's a qualitative kind of study. If you wanted to look at data that you had about patient satisfaction and make some assessments of how your staff were doing, that would require a different kind of study, perhaps a correlational study. So every kind of question gets a different method to answer it. And the most important thing is to know what question you want to answer. And that is the hardest part, really, of a study, is defining the question. So that's the first thing. I sometimes spent as much as 2 years talking to a group of people to get to the point where we have the question down absolutely clearly. The next thing that you have to do for most studies is to really define the variables. So again, if you're looking at an intervention, you have to spell out very clearly the kind of patient, the kind of problem, how you're going to measure it, and to do that, you have to know exactly what it is you're measuring. And those are some of the variables that you're going to be looking at. Once you've done that, then you can go ahead and pick the research design or methodology that is really going to answer your question. But my advice is, if you don't know or aren't sure, don't just go ahead. Find somebody to help you who knows what the best way is to do this. So contact people in your own institution. If there's a research department, contact them, talk to them about it. If you don't have a research department because you're small, find the nearest college or university and see if you can buy some services for them to help you with the study. They don't have to do the study. They just need to be able to provide you with information that will allow you to do it.
How can nurse leaders identify what organizations to seek grant funding from? And what do they need to know about matching their expertise with the organization they're seeking grant funding from?
That is a very important question, and it's a difficult question because depending upon the organization, you may have some very specific guidelines that they want you to meet in order to get that money. So there are some organizations that will fund particular kinds of projects. There are funding organizations that are more open and will find a broader area. For nurses, there are nursing organizations that have smaller grants that can help you get started on a bigger project. So, for example, the American Nurses Foundation, Sigma Theta Tau, all have funding available, and you can write a grant for $20,000 to help you with a project. That's a rough amount of money. That's not written in stone, and there are different kinds of and levels of grants. But they have grants that are available to nurses that have a fairly broad context that you can apply to them for. Then there are organizations that provide funding that are very specific. For example, the Nurses Oncology Association has many grants that they give every year, but you have to fit the parameters of it has to be a problem related to cancer and cancer nurses working on it in order to get that funding. There are also organizations like the American Diabetes Association or the American Heart Association that gives funding out. They, again, are looking at problems related to their area, but it's a little bit broader than some of the nursing organizations might provide you with. When you are looking for grant funding, you really have to make sure you understand what the criteria are for that organization. And unfortunately, sometimes it's not all written down. So when you go to the website, you may not, in fact, find the information that tells you that this is their narrow focus right now. And I actually worked with a small organization that I'm on the board of directors for to put in a grant a couple years ago. And after we put the grant in, they came back to us and said, oh, well, we never give this kind of money out unless we spent years talking to the people to decide whether they're worthy. It's like, okay, but there's nothing in your website that indicates that. And so that kind of thing can happen also. And you shouldn't let that discourage you. You just learn from it. You try to figure out, well, what are the steps to take to be able to get funding. And there are some resources, and I have a couple of URLs that you can go to on the web that help you find appropriate foundations for your funding. And those will be included in some materials that you'll be receiving related to this course.
What tips can you give nurse leaders when they're searching the literature to identify if their idea is innovative? You know, we often think our idea is the first.
Well, that is a very important part of research, is making sure that what you want to do is in fact going to somehow be innovative. And in fact, for the federal funding, innovativeness is one of the major criteria that they are currently using to provide funding for grants. So NIH, for example, you have to write out in detail how it is that your idea is innovative. And sometimes it's very hard to come up with that piece. So you need to make sure when you go to the literature that you have a broad-based literature search. Just searching CINAHL, the Cumulative Index to Nursing and Allied Health Literature, is probably not sufficient, because there are other groups that may have done research in this area, and you need to look at their databases also. For example, in nursing, physical therapy, for a nursing kind of a topic, physical therapy, occupational therapy, social work, psychology, may have done something right up that same topic that is exactly what you want to do. And if they've already done it, no funding agency is going to give you money if you don't describe how what you're doing is different from what they did. So part of your background search is to find out what's been done in all different disciplines that are pertinent to the topic, and then to be able to say how what you're doing is different than those things. So some of the databases that you should be looking at besides CINAHL are PubMed, see what the physicians are and some other groups are doing, Social Science Index, the Cochrane database, the Joanna Briggs database has some guidelines that are available that may influence what you're doing. Social Science Index and something like Psych Abstracts or Psych Info would be important to look at. So think much broader than nursing, because healthcare is broader than just nursing. And if we just focus on our little tiny piece, other people may have already done the work. The other thing that you need to think about is the time frame. And that, you know, there's a notion out there that 10 years is magic. 10 years is not magic. If you are doing research or want to do research in an area that is highly technologically dependent, you may only need to go back 5 years. They only may be doing what you're talking about for the last 5 years. So going back before that isn't going to be helpful. If you're doing something that's very people-oriented, and it's kind of an interpersonal kind of an issue, you may need to go back 20 years. It really depends upon your topic, and you have to really think about, okay, when did this kind of start talking about this topic? You know, when did people start thinking about this? And have I gone back far enough to make sure I've gotten everything that's really out there? And your literature search should be extensive. The federal government in particular really wants to make sure that you really know what's in that literature. Now, that doesn't mean you're going to write everything down on the grant, because they limit how many pages you get. But you have to understand it well enough that you can describe what's been done, what hasn't been done, and why your piece of research should be the next step.
When you're writing the grant proposal, we know it's so important for the information to flow smoothly, because the grant reviewer is going to be developing an understanding of what your project is about. Can you give nurse leaders some tips on how to make sure that information flows smoothly?
Well, grant writing certainly is very complex in that regard, because you have a whole variety of pieces that have to flow together. You have your actual proposal, you have a budget, and in your proposal you're going to have different sections, all that have to mesh exactly. And one of the things that happens to people as they write grants is they come across problems. They're working on it and the statistician says, well, you don't have enough subjects to do that kind of a design. So then they have to go back and add subjects. If they don't go back and rework the budget, then they're not going to have enough money in the budget to add those extra subjects. And since budgets are always limited, what do they have to give up to add those extra subjects? All of that requires every single piece, the description of the subjects, the budget, the methodology piece, all go together. And the only way to do that is you have to keep rereading it. So you make one change, you have to go back and read every single paragraph again to make sure that it's not influenced by the change that you just made. And if you have someone else type it, one of the lessons I learned the hard way is to make sure you review the budget yourself after it's been typed. I had someone leave a zero off once on me, and it made a whole lot of difference in what I was able to do. A simple mistake, but you can't go back to the federal government and say, oh, by the way, there was supposed to be another zero there. Or any agency and say there was supposed to be another zero there. So as the person who's the primary investigator, your job is to make sure that every single piece flows together. And it's not always easy to do that. So what you want to do is, once you think it's perfect, or as perfect as you can make it, ask other people to read it. Ask the other team members to read it to make sure everything flows. And then get some people who are less familiar with the topic to read it and to tell you whether they really understand it or not. Because the person who reviews your study may not be an expert on that particular phase or piece of science. And so you have to have explained it well enough that they can understand it. Because if they don't, then they're going to, cut you down because they won't think it's important.
We know that organizations that provide grant funding often will give us clear directions on what they're expecting in the grant proposal. Can nurse leaders deviate a little bit from those instructions, or should they follow them explicitly?
In a word, they should follow, well, it's more than one word, they should follow them explicitly. And let me talk a little bit about that. A lot of the instructions for writing grants are related to having a consistent format for the reviewers to look at. The worst thing you want to do is make your reviewer irritated. Because if they're irritated, they're not going to look favorably on whatever you've written. So you want to make your grant as user-friendly as possible. So if the font is spelled out to be a 12-point font, do not try to use an 11-point font, because they'll know the difference. And a lot of reviewers are experienced and therefore somewhat senior in their years and have visual problems. And especially when they're trying to read something on the computer, if you've changed the font on them, they may be very unhappy about that. But the other reason that you really want to follow those instructions very clearly is it says to the organization that you really understand what they want, that you are willing to help them meet their purposes by doing your research with them. And if you are not directly on target with their areas of interest, what they have put out as their priorities, you're much less likely to get money out of them than if you are doing everything exactly as they've asked you to do it.